Hey guys, welcome back to LoopHub. Today we'll talk about the most disgusting Dr. Pimple Popper moments that made us shudder. Let's head into it. Number 1. 3-year-old cheek cyst. Dr. Pimple Popper has kept up with her bulge of acne-related videos despite the busy Christmas season. On Monday, she posted a YouTube video in which she described how she treated a 3-year-old cheek cyst on a woman's face. According to the Mayo Clinic, Dr. Pimple Popper, whose real name is dermatologist Dr. Sandra Lee, diagnosed the development as an epidermoid cyst, a form of cyst that develops when skin cells burrow and multiply beneath the skin. Epidermoid cysts usually grow slowly and are not unpleasant. Lee used an injection to number the cyst and then made a small oval-shaped incision on the apple of the woman's cheek where the cyst was growing to treat it. Because it was difficult to force pus out of the incision at first, she dubbed the cyst a troublemaker. Lee used scissors to free the cyst from the cavity she'd created. The cyst was difficult to remove, said to Lee, since the woman had crushed it a lot on her own, causing scar tissues to form on the inside of the skin. Lee was able to extract a little mass that resembled a rubber ball with tweezers after more cutting and squeezing. The outside of the growth felt rubbery, according to Dr. Pimple Popper. Lee used a cauterizing pen to stop extra bleeding in the wound and sewed it up to seal it after she removed the cyst completely. She advised the patient to leave the stitches in for 7 days in order to allow the incision to heal properly. Cysts can range in size from tiny to massive. Internal organs can be displaced by very big cysts. Although the majority of cysts are benign, some might be malignant or precancerous. A cyst is a non-necessary component of the tissue in which it is found. It has a unique membrane that separates it from the surrounding tissue. The cyst wall is the exterior capsular component of a cyst. If the sac becomes infected and filled with pus, the cyst becomes infected and becomes an abscess. Number 2. 5 pounds of fat mass. Dr. Pimple Popper went on a bursting spree in her holiday-themed TLC special to cap off a year of both in-person treatments and internet consolations owing to the coronavirus pandemic. Dr. Pimple Popper Season Squeezing, which launched at 9 p.m. Monday, included the same lipma, cyst, and black hat action as prior videos and television episodes of Dr. Pimple Popper, but with a seasonal twist. Dr. Pimple Popper, whose real name is dermatologist Dr. Sandra Lee, treated 7 patients with a variety of skin tissues such as lipomas and cysts during the hour-long episode. Marilyn, 76, had a 5-pound grapefruit-sized lipoma, or a fat-filled mass, growing on her upper arm, and her treatment was perhaps her most eye-catching. A lipoma is a fat-filled growth that develops between the muscle layer and the skin layer of a person. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches, according to the Mayo Clinic. A lipoma is usually not cancerous, but if it hurts or irritates the person who has it, a dermatologist can remove it. Marilyn said she generally holds Christmas celebrations at her home, but she hasn't in recent years due to the weight of a mass on her arm, which has been growing for 15 years. She can't lift huge pots and pans full of food to serve a family because of their weight, she added. Dr. Pimple Popper had Marilyn lie on her side with her lipoma-bearing arm facing the ceiling to remove the lipomas. Then Lee injected a numbing medication into it so Marilyn wouldn't feel the cut and pressure. The present moment when Dr. Pimple Popper cut through the lipoma center, a big, lumpy yellow fat deposit emerged. It was so big that Lee compared it to Marilyn's 9th kid. Dr. Pimple Popper was able to draw most of the fat to the surface of the wound with her hands and scissors. Small parts, however, remained wedged under Marilyn's skin, requiring a little additional probing and chopping, according to Lee. It's been stuffed in there all comfy for a while, Lee remarked as she sliced away excess fat from the lipoma to allow her hand to pass through the incision. It'll take some effort on my part, but it'll be worthwhile. Dr. Pimple Popper passed Marilyn's arm and sent her on her way to complete the therapy. Marilyn told Lee, tearfully, that she was looking forward to wearing short-sleeved shirts again and taking care of her family for Christmas. Number 3. 5-year-old growth. Surprising treatments are among Dr. Pimple Popper's most popular, and a recent lipoma extraction shared by the celebrity dermatologist on YouTube was no exception. Dr. Pimple Popper, whose real name is Dr. Sandra Lee, treated a social media manager with a lipoma that had been growing for the past 5 years in the December 16 video. Because the entire video was zoomed in on the growth itself, it was unclear where the lipoma was on his body. A lipoma is a fat-filled growth that develops between the muscle layer and the skin layer of a person. Lipomas form form when a fat cell multiplies and creates its own little world beneath the skin, as Lee explained in the video. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches according to the Mayo Clinic. A lipoma is usually not cancerous, but if it hurts or irritates the person who has it, a dermatologist can remove it. That's exactly what Lee did, starting with a 3-inch cut into the bulk. She then used scissors to expand the wound and cauterizing pen to halt the bleeding, making it easier to see where the growth was and where the growth should be pulled out. She could only get a little chunk of fat out at first. However, when she squeezed the growth, a wet, yellow, chunky lump popped to the surface. She snipped that part away and kept cutting and squeezing until the lipoma was mostly gone and only a cavity in the patient's skin remained. When Dr. Pimple Popper double-checked the region before stitching it up, she discovered more lipoma-filled pockets. Lee described finding these tucked-away lipomas pieces as mining for gold in the video title. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen right now because I'm sure you'll love them. With that, I'll see you in the next video.